Good afternoon, everyone. Very excited to be here. As she just said, I'm Janke, and I'm very lucky to work with the Adolescent Accelerators Hub, which is based at the University of Cape Town. And I'm here to present on behalf of a big team, but specifically my colleague Catherine Roberts, who is leading this analysis, but she's currently in the UK. And if you see a trend here, this is because this is another part of the Hey Baby work that my colleague Nontokoza has just introduced. But this specific analysis is focusing on mental health among adolescent mothers living with and affected by HIV in South Africa, the effect of COVID-19. And so even before the onset of the COVID-19 pandemic, adolescent girls and young women in South Africa were already experiencing multiple mental health stresses. And for young mothers, in addition to their daily socioeconomic stresses, especially those affected by HIV, they face a unique set of challenges that make them even more vulnerable to mental ill health. And this is important to the HIV response, as research has shown that mental health impairments increase the risk of HIV acquisition and negative health outcomes among adolescents living with HIV at every step of the HIV care cascade. And in a review recently by our study PI, Professor Lucy Kluwer, it was highlighted how poor mental health could be linked to increased risky sexual behaviors, decreased antiretroviral adherence, faster HIV disease progression, and also impaired prevention of mother-to-child transmission and effects on child development. And so, previous analysis from this cohort of young mothers found that even before the COVID-19 pandemic, young mothers living with HIV had significantly higher rates of poor mental health than mothers not living with HIV. And that brought us to our main research question for this analysis, which is, did the COVID-19 pandemic have an effect on the mental health of adolescent mothers, and did this differ by HIV status? And so to answer this question, we used data from the Hey Baby longitudinal cohort study, which was just mentioned by Nontokozo in the previous presentation. And this is the same cohort of 1,045 young mothers residing in the Eastern Cape province in South Africa, of which this analysis uses data from 704 of them, who now have an average age of about 22 years, and 30% of whom are living with HIV, so almost 1 in 3. The longitudinal nature and the timing of this data collection allows us to compare differences over time, and since our baseline data collection happened between 2018 and 19, this was obviously pre-COVID, and our follow-up round happened between 2020 and this year, which is post the onset of the COVID pandemic, and throughout kind of the thick of the national lockdown restrictions. And then to measure mental health, we used 4 validated mental health scales that were self-reported. And for the purpose of this analysis, we define common mental disorder as scoring above a predetermined cutoff on any of the 4 scales, which were depression, anxiety, post-traumatic stress, and suicidality. And now in looking at some descriptive findings of the current mental health of this cohort, so post-COVID-19 onset, we find that overall, half of the mothers now reported having any mental disorder, and this was marginally higher amongst mothers living with HIV at 55%. And this number is mainly driven by depression and anxiety, as we can see that 28% and 24% reported having depression and anxiety symptoms respectively. 12% had suicidal thoughts or actions, and 6% experienced PTSD symptoms. And when comparing participants scoring above the cutoff for mental health symptoms pre and post-COVID onset, we found significant increases in poor mental health on all measures of mental health symptomology. And this includes comorbid mental health conditions, which is having symptoms of 2 or more types at the same time. And to focus your attention on the dark pink line at the top, you can see that the share of participants who reported having any common mental disorder rose from 13% before the pandemic to almost 50% after the pandemic onset. And to look at these changes in more detail and to kind of better quantify resilient mental health, in other words, having good mental health even during the pandemic, we split this cohort into 4 groups. Those with no common mental disorder at both time points, those with chronic poor mental health before and during the pandemic, and then those who had improved symptoms, so those who had no common mental disorder before the pandemic, had common mental disorder before and it somehow improved during the pandemic, and then finally deteriorating common mental disorder, so having no common mental disorder before the pandemic, but reported having newly poor mental health after the pandemic had started. And the results showed us that for a large proportion of mothers, around 40%, who reported poor mental health during the pandemic, this was a new issue, with smaller proportions having either chronic poor mental health or improved mental health, which was around 5%. And something important to note here is that although there is somewhat of a trend of adolescents living with HIV having worse outcomes, we did not find a statistically significant difference by HIV status for any of these measures. And then finally, with these 4 different groups in mind, we wanted to determine which sample characteristics were associated with constant good or improved mental health. And so which factors had a protective effect on the mental health of these young mothers. And 2 of them came out as significant. Firstly, food security, and secondly, having no experience of abuse or violence, whether it be at the personal, household, or community level. And so to summarize, globally this is the largest longitudinal exploration of mental health among adolescent mothers that we know of, including young mothers living with HIV. However, important to note that this is still an exploratory analysis and analyses are still ongoing, and we're happy to hear any of your ideas. But when looking at our data from our mothers over time, we found a significant deterioration in mental health during the pandemic across all measurements. We also find that provisionally the 2 factors that are most strongly associated with resilient mental health is food security and no experiences of violence or abuse. And so with this in mind, what can be done to help adolescent girls and young women, and especially young mothers? Since we find that there is now a larger number of young mothers struggling with mental ill health, we need to make sure that we identify them effectively by strengthening mental health screening, linkages to care, and referrals to relevant services. We might think that the worst of the pandemic is now over, but it's important to remember that the effects thereof extend wider still, for example, in decreased antiretroviral adherence and also delays in child development. Further, food security and violence prevention seem to have a protective effect on maintaining good mental health, even during a pandemic. And so to reiterate, that we should continue to offer our efforts to maintain these, especially in times of emergencies or crises. And then finally, having good policies don't mean that much when they're not implemented in the real world, and so we need to ensure that we implement adolescent responsive services to mitigate the worst impacts of poor mental health, not only for mothers, but also for their children. And then just thank you to all of the collaborators, the amazing data collection team, and all of our funders.